Tonight we're learning about a child who's died from measles, marking the first death in this recent outbreak and also the first measles death in the United States since 2015. Here's what we know. The child was not vaccinated against measles. State officials say the child was school-aged. The child was being treated at a Lubbock hospital. Right now, the state health department is reporting 124 cases of measles across 9 Texas counties. Most of the cases are children younger than 18 and those who are not vaccinated against the virus. Today at a press conference, a local doctor explained how effective the measles vaccine is.
We're very lucky to have an extremely effective vaccine for measles. Having 2 doses of measles vaccine confers 97% lifetime immunity. So for those of us who are fully vaccinated against measles, the risk is extremely low of having any issues at all with measles.
Well, the outbreak began late last month. It's primarily spreading among the Mennonite community in West Texas. A majority of those cases are from Gaines County, which has one of the highest rates of students who opt out of required vaccines. With news of the first death linked to the measles outbreak, there are lots of questions going around about what the virus is and what you can do to prevent it. 6 News reporter Sydney Walker spoke with a local doctor to find out what we all should know about measles. Sydney?
Well, as of now, there are no confirmed cases in our area, but there are people here concerned about what's happening in Texas. We're here to help sort it all out. The measles can take up to 2 weeks from the time of being exposed to present symptoms, and a patient can be contagious up to 5 days before they even begin to feel bad. These symptoms begin with feeling run down. Then comes the fever, the cough, the runny nose. But the main tell is the red speckled rash. Those that are most at risk are children under a year old who are too young to receive the MMR vaccine, as well as the elderly and the immunocompromised. But Dr. Tim Martindale says that if you've received the MMR vaccine, just 1 dose of the standard 2, you should be safe.
For most people, measles is a limited virus. So if you're a young or normal-aged, healthy person, most of the time you're going to be okay. You're going to be miserable, and it's going to last for up to 2 weeks, and you'll feel it, but you most of the time do okay.
Martindale says the scary part is the potential risk for an infection in the brain, which can cause your whole body to collapse. The MMR vaccine remains the main recommendation for staying safe from the measles. The vaccine given at ages 1 and 4 gives most people lifelong protection. But Texas health officials are expecting more cases, and we'll talk more about that coming up at 6 o'clock.
Yeah, a lot of people in my mom's group are all talking about this. Sydney, thank you so much.